The DDU receives many inquiries from members on the topic of consent, so we thought it would be helpful to go through the topic and review the basic principles. One of the main principles to remember is that consent is a continuous process and not a one-off event. Fundamentally, the consent process is an exchange of information between a clinician and patient such that the patient is able to make a decision on the treatment that they're willing to undergo. Given the imbalance in knowledge between a clinician and a patient, one of the key actions in the consent process is to seek to bridge that knowledge gap by providing information and answering questions in a way that a patient can understand. We often hear or see the term informed consent, when in fact a more appropriate term is valid consent. Valid consent means that in addition to providing information to a patient, that information is communicated in a way that an individual patient can understand. The language and terms used to communicate with a patient may therefore necessarily vary according to the capacity of that patient to understand. Part of the consent process may therefore be to ask the patient to confirm their understanding of the information that you have provided. Principle 3 in the GDC standards guidance deals with the topic of consent, and Principle 3.1.3 deals specifically with what patients may want to know or need to know during the consent process. These include the options for treatment, including no treatment at all, the risks and benefits associated with each of the options, whether you feel a particular treatment may be preferable, the benefits, risks, consequences, and likely prognosis of the proposed treatment, including what may happen if no treatment is carried out, the costs of the treatment, and finally any other information such as guarantees, etc. Principle 3.34 in the GDC standards sets out your duty to record the consent process within your clinical records. We're often asked how best to do this, and our advice would be to record the thought process that you've given during your discussions with the patient. The GDC standards say that there are only 2 circumstances in which a written consent form is required, and that is for treatment provided under either general anaesthetic or sedation. In other circumstances, consent forms can be helpful in summarising the information that has been discussed or providing evidence that the discussion has taken place, but in itself a consent form is not evidence of valid consent having been sought and obtained.